see a lot of innovation come across your desk. And so I'm just curious, like broadly, you don't even name a specific company, but sort of categories or trends that you're particularly excited about when it comes to healthcare innovation. Chris, maybe we'll start with you and then Paul on this one.
Yeah, so I'd break it down to a couple of areas. I think we're at a different stage of innovation we were 5 years ago. I think 5 years ago, to be an entrepreneur in the sector, you probably need to be an established healthcare operator. I think you look at innovation in other industries, a lot of great companies are started by people who've come from without the sector, and they have a naivety, but they also, have a questioning attitude. And so I think we're reaching a point in healthcare where you can be a non-healthcare expert and build a healthcare business, which I think will be great. But I think we're tackling, areas that we hadn't before. Health equity, we're tackling it more aggressively. 5 years ago, I think that probably wasn't a subject people want to invest in. Rural health, hospital at home, some big issues that we need to deal with that are now kind of mainstream, and mainstream capital is prepared to take a punt on, can we build businesses that are transformational and that are not necessarily purely tech, but there's a tech and service. Then I think to the whole community topics, there's a lot more of these businesses that are going to be enablers, the sort of picks and shovel businesses on which other businesses can be built. And so I think I'm excited to see that. And that could be, really across the stack to help that transformation happen. I think, areas like telemedicine have gone from episodic to longitudinal, right? So, we're seeing these digital mediums, not being just used in a very, very low frequency way, but actually realizing that they need to develop a relationship with a patient, and it's not independent of a PCP, but it's a relationship-based business. And then obviously from payment models, we've clearly seen the success of value-based care in the primary care field. And we're seeing, big payers like United say, well, look, am I prepared to sort of hand over risk around certain specialty areas where people can create a medical home? And so I think that's a lot of innovation will happen in certain of these specialties as well. And value-based care, will accelerate. I think couldn't be more optimistic, couldn't be a better time for entrepreneurs to come into healthcare.